This episode is brought to you by MedBridge Education. Log into medbridgeeducation.com/TN Therapy Outsource. Use the promo code Dr. Mike or alternative to get $200 discount or over 40% off. Gain access to 1,000 plus online courses, compliance training, certification preps, program, and so much more. So again, thank you very much. Enjoy the show.
Hello ACG, this is Dr. Mike Chu again, physical therapist and certified dementia practitioner, and thank you again for watching our Alternative Careers Group podcast. And I'm here with Nate, Dr. Nate. He's actually from Tennessee too, in Clarksville, but he works for the military. He's a physical therapist and he works for the military, and he's here right now to teach us. If you're a therapist, a PT or a PTA or OT, OTA, that you want to go and work for the service, and he's the guy. And normally I would tag him if some people would ask, hey, how do I get into the service? Because there's so much benefits, so much perks when you go into the service. So again, thank you, Nate, for joining our podcast. Appreciate you. So tell us about you, sir.
Okay, so I'm a physical therapist for 4 years. I grew up in Tennessee, went to Georgia Physical Therapy School, and made my way back. Worked for the United States Army at Fort Campbell. I'm a civilian employee, so there's different avenues to working with the service members, just depending on what your interests are and opportunities you're looking for.
So I guess our next question is, how do you? Well, first maybe because if I'm a civilian, can I go in and apply for a job in the Army or in the Air Force?
Sure. So there's a couple ways to work with our service members. One is usajobs.gov, and that's where all the federal job postings are. There's constantly changing, daily adding and taking down, things like that, depending on your profession. So typically when I look at physical therapy. Physical therapists, I've seen occupational therapy jobs. We use DTAs, ATCs.
Okay, so they accept assistants and ATCs. So
sure, yeah, just depending on what their needs are and what they've been, what they call billeted, what they've been given slots for. So that's one way to go in as a actual government employee, working with the service members or the VA. Or it's all government jobs go through usajobs.gov.
Okay, so usajobs.gov. So we'll put the link there too. So if you're interested in wanting to join the service, the military, as a civilian, reach out to Nate. He's the man. And so again, first, if we're a therapist or an assistant, so we just go there and apply.
Yeah, if there's a job opening, it'll take you step by step through the application process. If you don't see what you're looking for there currently are contract jobs available, whether they're just looking for seasonal fulfillment or...
It's like 1099?
Depends on who's managing the contract. So typically you'll be a W-2 for the contract company, and then they'll fill you in to wherever you're working. Typically you'll see those on sites like Indeed or Monster, LinkedIn, things like that, and you'll get plugged in based on that. Typically they're not usually travel opportunities, although those do pop up every now and again, but usually they're local contracts.
I guess I'm not a U.S. citizen, so I'm throwing out there now.
Yeah.
Do you need to be a U.S. citizen to be employed?
I believe you do.
Okay. So you need to get your citizenship if you're...
Sure, yeah. So you have to be, if you're a male, you have to be registered for selective service and all of those things, just like if you were to actually be joining the military.
So do I need to take there's
not a physical fitness test.
I did ROTC, by the way,
you do have to acknowledge that you're able to move a certain amount of weight and repetitive motions and things like that, just like any other job description for either of those. Now we had talked earlier about actually joining the service, and so that's a little bit different process that I'm happy to talk about because I've gone through it a little bit. I haven't actually joined the military, but I'm kind of in the process there and understand a little bit how that works.
Is there any age limit? I assume there's an age limit for it?
Yeah, so they have...
I'm on my 40s, so can I still join?
There's requirements. I'm trying to remember what they are. I want to say for PT 35.
I guess I'm not qualified anymore, right?
Now, if there's shortages, high demand things like certain physician specialties, things like that. You can get what's called a waiver, which is basically saying that they're documenting that you don't meet this requirement, but they're allowing you to progress. So if you're looking at joining the service, you can find that information on their websites. But as far as like being a civilian employee, there's age limitations there.
How about, let me ask you about benefits. We always ask about benefits, right? PTOs and stuff, but what are the special benefits of working for the government?
Well, it's a large employer group, so typically the rates are pretty good. So for myself, with our health insurance, you get a list of 40 plus insurers that you can choose from, and you just have to research who's going to give you the best coverage for the rates and things like that. You start out, you get 10 paid holidays, federal holidays. You accrue your leave, and right now they have it separated between sick leave and vacation leave. So you start out typically there over a year accruing 13 days of each, and you can carry over the hours.
Oh, you accrue that.
Let's see what else. You get access depending on who you're working for. So I work for the Army. I have access to certain benefits on base. So I can go use their fitness facilities. I can use their parks. I can use their what's called the PX, the Post Exchange. Their market centers, it's like gas and things like that.
Wow.
But I can't go to the PX that's their Walmart.
Because that needs to be for the military person.
Right, because that gets into taxes and things like that. But you pretty much have access to anything that a family member would, with the exception of commissary and the PX.
Oh wow. So normally we also ask this to the pay. Is it better on the regular outpatient clinic, or same, or comparable? Or?
It'll just depend on the person. For me, it was quite the pay raise. But all federal wages are public information. So you can go on to the OPM, Office of Personnel Management, and you can put in whatever you think you'd be. So they have a couple different wage systems. They have the general schedule and the federal wage schedule. I'm a GS, so general schedule. And based on whatever your job you're looking at, it tells you what the GS rate would be. So for physical therapists, usually it's a GS 11 to a GS 13. So you can go in there on that website, put a GS 12 with this step. So your steps are your pay raises within your category. And then they have locality adjustments. So the idea being that if you live in San Francisco, it's going to be more expensive than if you live in Martin, Tennessee.
Yeah.
And so they adjust that for the more expensive places, so you get a pay raise to cover cost of living. But that's going to depend on the person.
Okay. How do you raise your pay raise? Promotion, and you have performance review too? Like.
Yep.
Okay.
Yeah. So you have your annual reviews, your performance reviews. But as far as your raises go, a lot of that will. Your cost of living raises will be set by Congress with a budget. So if you followed any of that this year, that was a big topic that was coming up with the lapse in the budget, people not getting paid for a load. But you have your step, okay, GS whatever, and then it's a 1 through 10. Or sorry, you have your grade, GS whatever, and your step 1 through 10. So if you come in as a step 1, after a year you'll get a step increase, which is a raise. Up to step 4, and then after step 4, it's every 2 years you get a step increase until 7, and then after that it's every 3 years. So again, you can look at the specifics on that as far as what that would be, but you kind of have a set schedule when you'd be due for a salary raise. There's other incentives that would depend on your job and your department and things like that.
Okay. How about patient-wise? What's your normal, usual patient caseload? I assume amputees.
So as far as
PTSD,
diagnostics, so right now there's not as many amputees because we're not at war.
Okay. That's good, right? By the way, that's good.
So early 2000s, early 2010s, there was more of that, but we're not in engaged anymore right now, so there's not as many combat injuries. They do happen occasionally, but not widespread like it was before. So it's a lot of, for me, overuse, chronic injuries, some acute sports medicine stuff because of the physical training every day, and post-operative stuff.
Frequency-wise, we want to know, because in the outpatient world or home health, we do a different frequency. How about with the frequency? Do you follow the 3 times a week, 4 weeks, or do you decide, or the physician decides? Or
the frequency will depend on your location and how your clinic is built. What's nice about working in the federal system as a therapist is that you're totally autonomous. You don't require referral from a physician.
So direct access.
You have direct access. You have access to imaging. You have access to some medications.
Yeah, I remember that.
You're able to refer out to specialists within your post. So if we don't have a rheumatologist on post, then we need to go through a primary care provider to get that referral off. But if I need somebody to orthopedics, I need somebody to go to chiropractic, if I need somebody to go to internal medicine, I can send that. But a lot of it's going to depend on where you are. So for me, where I'm at, overuse and sports injury type stuff.
Probably back, shoulders.
Yeah, lots of backs, lots of knees. I work with some aviators, so they wear those helmets for long periods of time.
Oh, aviators! Gosh, helmets and everything.
Yeah. So it's really going to depend. There is some PTSD and anxiety disorders and stuff like that you kind of got to work around. But typically, you have access to all the other providers and can as well as you can work as a team.
So you got direct access, prescription power too, right?
Limited, but yes.
Limited prescription and imaging. I mean, gosh. So if you are interested in going into the service or just being a civilian employee for the service, reach out to Nate. He's going to have a course soon. A physical therapist to go into whatever service, and that's my challenge for him and for everybody. Find that alternative career, not just in the physical therapy or in the public world, and also in the service, because you're not only serving yourself or your patients, he's serving the country by being this and being the best that he can be. And I really appreciate him, and thank you, Nate, for your time, and appreciate you. And again, thank you very much for watching and listening to our podcast. Appreciate you, and have a great day. Bye-bye.
Thank you for listening to our show for today. Again, if you need education, you need CEU courses, log into medbridgeeducation.com/TN Therapy Outsource. Use the promo code Dr. Mike or Alternative. Again, thank you very much for watching our show. God bless you, and always remember, movement matters to your brain matter. God bless you, and have a great day. Bye-bye.